evening, Bermuda. On April 23rd, the new moon represented the start of Ramadan, and for Muslims around the world. Here in Bermuda, and on behalf of my family and the government of Bermuda, I would like to extend greetings and warm wishes to our local Muslim community. Ramadan Mubarak. Bermuda is a country of diversity, diversity which enriches our culture and our community. I join Bermuda in thanking our Muslim community for their positive contribution that they continue to make in Bermuda. Of course, I'm saddened because I get to attend events that celebrate this particular event, but this year, of course, those events cannot happen. Never far from our hearts are the people who have lost loved ones to COVID-19, those who are right now battling this virus. Our prayers continue to be with you. Also, never far from our thoughts are those who have been economically displaced by this pandemic. Thousands of Bermudians in the blink of an eye found themselves without an income and without the means to provide for themselves. In response, the government, through the Ministry of Labor, Community Affairs, and Sports, in conjunction with the Ministry of Finance, launched the COVID-19 Unemployment Insurance Program. We are getting a number of phone calls and emails from persons anxiously awaiting their unemployment benefits. And though over 5,000 residents have been paid over $7.7 million to date, there are still some persons who have not yet received a payment. No later than Tuesday of next week, the 28th of April, the government will process and deliver instructions to our banking partners to process and pay unemployment benefits to over 2,000 new applicants and approximately 5,000 people that submitted in March but have not received benefits due to processing problems and incorrect banking information that was submitted. Individuals who have previously received benefits will be paid on the regular 2-week cycle this week, Thursday and Friday. Next week, Thursday and Friday. To speed up applications and processing, the Ministry of Finance has deployed a team of internal and external resources to work through these applications to ensure that payments are made no later than next week, Tuesday. Persons who submitted an application but have not received email confirmation that their employer has verified and validated their application should call their employer and ask them to do so. Meanwhile, all employers should check and take the necessary steps to validate the applications that they have received as quickly as possible. The Department of Workforce Development continues to work hard to process these applications, and that department themselves have received more resources to assist in that aim and endeavor. And there are some persons who have challenged the government whether or not it's doing enough in this regard. What I would say is that the enormous effort to create a system and to process payments for 5,000 persons already and looking to do an additional amount this upcoming week is proof positive that though the government is closed, the government continues to work and will continue to deliver for Bermudians. Now more than ever, Bermudians must be prepared to invest in themselves and take advantage of the grants, scholarships, and student support available. Please take advantage of the training courses that we are providing via the Department of Workforce Development and online through the Bermuda Economic Development Corporation. Earlier today, drive-through testing of Bermuda's essential workers began at Southside. There were some hiccups in the beginning, but I'm told that things are in full swing now, and I'd like to extend my thanks to the Minister of Public Works, who is helping to make sure that all is going smoothly. Essential workers testing is arranged via individuals, via essential workers employers, so that means it's being organized by the regiment, the police service, the fire service, and the other employers of essential workers. This testing will continue throughout this weekend. We are further encouraged that of yesterday, Bermuda has the highest per capita testing rate in the Caribbean. And while this news is encouraging, we cannot forget the lives that have been lost and the 55 people that are currently fighting COVID-19, either in the hospital or at home in isolation. You remain in all of our thoughts and prayers, and we will continue to provide the resources, manpower, and collective energy of our government towards containing COVID-19. The Minister of Health will now provide an update from the Ministry of Health and will also detail the COVID-19 modeling, which is being made public today and which will inform our community of what to expect in the weeks and months ahead. Minister?
Thank you, Premier. Good evening. As reported last night, 61 test results were received yesterday, all of which were negative. We have received 80 test results today, but due to the need to inform the doctors and the patients, it would be premature for me to disclose any details this evening, but I can assure you that they will be made available as soon as possible. I need to pause for a moment because I'm truly disappointed to see that the Royal Gazette has already reported information prematurely and before any official figures are shared. I need you to know that this reporting has put the homes, the residents, and the staff in an extraordinarily difficult situation, and I am disappointed at the complete lack of regard of patient confidentiality and sensitivity to residents, families, and staff. I personally would feel completely offended living through a pandemic, as frightening as it is, to only have to hear about a loved one's results or question whether my loved one has results through the media without first being able to be told and informed by their own individual doctor. I can report that all residents at Westmeath have been tested and all of the staff are also being tested. And at the time of our recorded positive cases, they stand at 99. And as follows, they are 55 are active cases, of which 44 persons are under active public health monitoring, and 11 persons are hospitalized. A total of 39 persons have now fully recovered, and the total deceased remains at 5. The country has been following the developments with COVID trends locally and internationally for the past few months. And today I am pleased to present to you the modeling data generated by the Ministry of Health's Epidemiology and Surveillance Unit, with the guidance from Public Health England and based on the modeling that was completed by Imperial College London. As the COVID-19 pandemic evolves and more information becomes available, the modeling will also become more refined, as these numbers that I am presenting today will change. The data that I present to you today is of the 20th of April 2020. Now, it is crucial to know that the numbers generated through this or any model cannot be interpreted as predictions of what will occur during the current COVID-19 pandemic. Rather, they need to be treated as estimates of what might happen based on the assumptions that are used in generating these estimates and the modeling strategy used. Therefore, it is important to not get fixated on the exact numbers. The point of the model is not to predict the future, because no one can predict the future. However, it is to help to influence it and to help us prepare for it and to choose a good course of action. Likewise, the worst case scenario is also a planning tool. It provides a ceiling figure for the maximum foreseeable impacts which would occur if COVID-19 outbreak was uncontrolled. Some of these numbers may sound scary, but recognize that the worst case scenario is what Bermuda could experience with no interventions or public health measures. But Bermuda has already put in place such interventions, as well as a range of social distancing to the shelter in place in which we are currently under. So first, I will talk about the worst case scenario for Bermuda. The worst case scenario sees potentially over 54,000 infections, and that includes asymptomatic infections, over 3,000 hospitalizations, 981 persons requiring critical care, and 718 deaths. The peak for this case scenario would be between the 22nd and the 25th of May. But again, remember please that this would be the situation if no interventions or public health measures were put in place. And like I said, we've seen many interventions, including the shelter in place. The numbers are higher than what might be expected because of the severity of COVID-19 is age dependent. And of course, we have an aging population. As well, that population we see has more severe outcomes seen with an increasing age and a notable increasing since it is an 80-year-olds plus. And Bermuda, again, has an older age profile. and both the age structure and the mortality rates for Bermuda were incorporated in this model. Bermuda's better case scenario, which is what may occur if interventions are effective, potentially sees us with 17,500 infections, including, of course, asymptomatic infections, and just over 1,000 hospitalizations, 359 patients requiring critical care, and 263 deaths. The peak would be between the 6th and the 15th of September. And our aim is to do even better than this. Local data and intelligence is crucial in assessing what is happening locally and the impact on healthcare capacity. The modeling was done using the SEER model, susceptible, exposed, infected, recovery, with numerous assumptions, including no immunization in a population with assuming a 100% susceptibility, that symptomatic individuals are more infectious than asymptomatic individuals, and that upon recovery, individuals are immune to reinfection, at least in the short term. It was also assumed that the average duration from onset of symptoms to hospitalization is 5 days for those requiring hospitalization, and that 30% of those that are hospitalized will require critical care, and that overall average duration of hospitalization is 10.4 days. In the absence of COVID-19 vaccine, public health measures, or also referred to as non-pharmaceutical interventions, or NPIs, are the best defense against COVID-19, and these interventions are aimed at reducing contact rates in the population and thereby reducing transmission of the virus. These interventions include case isolation, quarantine, social distancing of those over 70 years old, social distancing of the entire population, and the closure of schools. And you would see that those interventions have been applied here in Bermuda. The effectiveness of any one intervention in isolation is likely to be limited. Multiple interventions used in combination may be required to have a substantial impact on transmission. Optimal implementation of these interventions could reduce peak healthcare demand by 2/3 and death by half. To avoid a rebound in transmission, effective interventions will need to be maintained at least intermittently for up to 18 months or more, depending on how immunity develops in the population, either herd immunity or through vaccination. There are very large uncertainties around the transmission of this virus. This likely effectiveness of different policies and the extent of which the population spontaneously adopts risk-reducing behaviors. Although it is unknown how the pandemic will continue to evolve, 3 outcomes can be envisioned. 1, complete interruption of human-to-human transmission. 2, recurring epidemic waves, both large and small. And 3, continuous low-level transmission. Based on current evidence, the World Health Organization states that the most plausible scenario may involve recurring waves interspersed with levels of low-level transmission. We will be publishing the model on our website at coronavirus.gov.bm shortly so that the public can review all of the assumptions in detail, as well as the results. We will also update the model regularly as our situation evolves. I now briefly want to touch on the topic of Bermuda's care homes. Water, please. Excuse me. As promised previously, we will be testing every care home in Bermuda. Today, health officials and Dr. Weldon met to formulate a national testing strategy, and will include not only rest homes, but also, for example, the essential workers, healthcare workers, return to work testing, and clearance testing for persons who are isolated and their contacts. Thank you. I can report that testing has now occurred in 4 of our 21 care homes, namely Westmeath, Matilda Smith Williams, and 2 other private care homes. There were 116 residents that have been tested and 136 staff members tested to date. In closing, while much attention is rightly and currently on COVID-19 cases, it is very important to remember that people continue to have other medical emergencies such as strokes, heart attacks, serious infections, etc. And KEMH's emergency department is open 24 hours every day and urges you not to delay in getting medical attention for any medical emergency you or a loved one may experience. Please call your doctors or 911 just as you did before the COVID-19 pandemic. Again, call your doctors or 911. Your condition could worsen if you do not get immediate medical attention. Thank you. Thank you, Premier.
Thank you, Minister of Health. Now, the Minister of National Security will provide an update on his ministry. Also, matters surrounding the airbridge flight from London, which is arriving now, and also information on how taxi operators can apply to be eligible for the provision of delivery services. Minister.
Thank you, Premier. On Wednesday, there were 13,633 community advisory point stops, and yesterday there were 11,532 stops. This evening, our disaster risk reduction and mitigation team are working with our colleagues from Customs, the Department of Health, the Royal Bermuda Regiment, Skyport, to welcome 97 returning residents back to Bermuda on a British Airways flight. All arriving passengers have been pre-processed electronically by the Department of Immigration to minimize contact with our customs officers. From a safety standpoint, personal protection equipment, or PPE, will be worn by all government officials. Each passenger will be given a face mask, as well as having their temperature checked in the arrivals hall. Once the passengers are through the landing process, the returning residents will be transported by the Bermuda Regiment to an approved government quarantine facility, which is managed by the Disaster Risk Reduction and Mitigation Team in partnership with a licensed security personnel and the Bermuda Reserve Police. This evening's arriving British Airways flight will also have on board critical and much needed medical supplies and PPE equipment. These include 12,000 COVID-19 testing kits, 10,000 N95 masks and personal protection equipment, and other non-COVID-19 essential pharmaceuticals required to meet the island's regular needs. In this regard, I wish to thank His Excellency the Governor John Rankin, the Deputy Governor Alison Crockett, and the Government House Executive Officer Ms. Crystal Swan, and Bermuda's London office for all of their hard work in facilitating this flight. Tomorrow, the British Airways flight will depart Bermuda with 74 passengers on board who are returning to the United Kingdom. To ensure the safety of all persons involved, we have instituted strict protocol process for tomorrow's departing flight. Again, the Disaster Risk Reduction and Mitigation Team, Customs, the Department of Health, the Royal Bermuda Regiment, Skyport, and the British Airways staff will work together to coordinate the process for the 74 passengers departing on the British Airways flight. I wish to extend my thanks to all for their efforts. Turning to the shelter-in-place approvals for businesses to operate, to date, 73 businesses have been granted permission to operate. These businesses have very strict guidelines in place and must adhere to them at all times. The public can visit www.gov.bm to see which businesses have been granted permission to operate. Any business that opens contrary to the emergency powers shelter-in-place regulations is liable to prosecution. Since we have instituted this process, we have received some feedback and queries regarding the guidelines for taxi operators. I think it's important to be clear that we must adhere to the safety guidelines that have been put in place by the Department of Health. So, for the avoidance of doubt, here are the guidelines for taxi operators. Taxi operators can provide courier services, and they must have a partnership or be connected with a permitted business such as a grocery store, a pharmacy, a laundromat, a pet store, a hardware store, a plant nursery, a shipping, freight, or courier company, or a water distribution company. The public can contact a business for the pickup of goods, and the taxi driver can be the courier to take the goods from the business to your home. Taxi operators should not be in the area of an approved business looking to be hired or searching for a fare. Under special circumstances, the taxi may be called by someone wanting to go to a grocery store, in which case it must be a pre-arranged pickup and the Ministry of Health guidelines must be adhered to. This includes social distancing, masks, no contact with customers, wiping down the areas of taxis and the packages. Thank you, Premier.
Thank you, Minister. And just to make sure that it is clarified that persons who own a taxi service must be approved by applying on the permitted business application website, and only permitted taxis will be able to operate. So make sure you go to the website, which can be found at coronavirus.gov.bm, to go ahead and to make that particular application. As I've mentioned previously, the gradual easing of some restrictions will be done in a way that limits the risk of transmission. We need to make sure that we continue to keep people supplied during this shelter in place. And we need to make sure that people who are sheltering in place have the necessary support while working from home, facilitating homeschooling and activities for their children, and supporting students who are now doing online learning. We want to help people navigate this new normal that will be with us for the next week. So with my cabinet colleagues' support, the following changes will be made in time for Monday, April 27th. I have asked the governor to further amend the shelter-in-place regulations to add office supply, computers, and computer supply stores to the list of permitted businesses. These will open on the same basis as other permitted businesses, also with the permission of the Minister of National Security, meaning that they will only be open from Monday to Wednesday and only for prepaid and pickup services only, or they can be done via delivery services, as the Minister of National Security just indicated. Home-based businesses will be able to operate for the delivery of their goods only. Again, someone cannot visit someone's house, but home-based businesses are able to continue to operate, which I had said earlier. Small businesses able to convert to home-based delivery operations will be permitted to either replenish or secure stock from their existing business venue for the purposes of delivering items from home. Also, wholesale food suppliers will now be permitted to engage in home delivery. I'm confident that the Ministry of National Security team will act quickly to grant the permissions so that persons with the surnames of A2F are able to take advantage of this on Monday. As your government, we receive many emails, voice notes, social media posts, and tweets of support and encouragement. Many of you are keeping us in your prayers, wishing us well, and encouraging us to protect our own health under these trying times. We are truly grateful for your support. This week, I received encouraging letters from Alexis Souza, a 10-year-old who attends Purvis Primary, and Angelo Burgess, a P5 student at Purvis Primary. Both of them took the time to write gracious letters of appreciation for the work that my team and I are doing to keep Bermuda safe. I was able to give Alexis a call earlier today, and I wanted to give Angelo a call as well, but we didn't get his number in time. So Angelo, if you're watching, thank you very much for your letter. The letter that you sent and the appreciation and encouragement expressed in that letter means a great deal to me. While we receive plenty of encouragement from our community, there are some who've questioned the bipartisan approach that we have taken, keeping the opposition informed and welcoming their ideas and contributions. Just for the record, in April, we had 3 WebEx meetings with members of the opposition. On April 3rd, myself, the Minister of Health, and the Chief Medical Officer, in addition with other officials from the Ministry of Health, had a general update via WebEx. Last week, on April 15th, it was myself, the Minister of Health, to give an update on the modeling information, and also on the 17th, the preliminary modeling information, and also last week on the 17th of April, myself, the Minister of Health, and officials from the Bermuda Hospitals Board were there to give an update on measures that were taking place for preparation at the King Edward Memorial Hospital. And myself, I have spoken on the phone with the Leader of the Opposition a total of 15 times in March and April. Earlier today, the Minister of Education also extended an invitation to all members of the legislature, including the opposition, to participate in the learning activities of our students. Despite the adversarial nature of the Westminster system, our record during the COVID-19 pandemic is clear, and our minds remain open, our doors remain open, and our phone lines remain open. And every member of the legislature has access to us by email or even via social media, and I will say that many of them do take advantage of that. It is very important that during this time that we continue to work collectively in order to save lives, and I'm going to do my best to remain above the fray so that we can have our energies focused on the work at hand rather than what our Westminster system will actually have us devolve to. In closing, to all those involved in protecting our health, caring for those who've contracted COVID-19, patrolling our highways and byways to enforce shelter in place, keeping us fed, and helping the government to keep you informed. Thank you very much. And before I go to questions, I actually got in a little bit of trouble on Wednesday when I went home because I promised my children that the next time I did a press conference, I would say hello. And I went home and Nia said, "Daddy, you said you were going to say hi to me and you didn't." So, sweetie, I'm sorry. And Nia and Ed, Daddy says hi and he'll be home soon. Happy to take your questions.
Good evening. With this flight,
Speak up.
Can't hear you, sir.
with this flight coming in, this BA flight coming in tonight, I was told that a nightly fee of $100 will be asked for these individuals, these parents, that these people coming in. Why now is this group of people coming in, and you already had 3 other flights come in that was in charge? Why are these people being charged for $100 a night for 14 days quarantine, Premier?
I can handle it. Okay. Trevor, this endeavor is exceedingly expensive, and we believe that it was necessary for us. There are a number of people that can pay. There are a number of people that came in by private jet, as you know, and have the ability to reimburse the government for their travel. There are a number, if we save money from this endeavor, we are able to use it in other means to support this endeavor and help people throughout our country. We made a process available where if a person was experiencing hardship, that they can apply for a hardship exemption. To date, 41 people that applied for the hardship exemption were granted the exemption. So the overall object of this enterprise were to get Bermudian students who were stranded overseas back to Bermuda. We believe that there are a number of people that could pay, and in those circumstances, we've asked that they do pay. For persons that could not pay, we created a form and we looked at an exemption process, and we've had a number of people, 41 people, who have been successful in getting an exemption.
Any thought of going back to those that have been on the other 3 previous flights to ask them if they can assist for what's already been done? You have the names.
We have, and Trevor, you'll be happy to hear that a number of people that have been in quarantine facility have reached out and asked how can they remit payment to the country for their stay in the facility.
Thank you. TNN understands that the police officers have been asked to dust off their riot gear. Are there any concerns that the commissioner might have reference to civil disobedience?
You actually said that really fast. I didn't get that, kind sir.
Sorry?
I didn't hear you, kind sir. You said it fast.
TNN understands that the police officers, the Bermuda Police Service have been asked to dust off their riot gear in preparation for deployment orders. Does the police commissioner believe that civil unrest is in the not too distant future?
Let me say this, Trevor. As you know, I'd like to remind the public that the operational side of policing forms and falls squarely as the purview of His Excellency the Governor. But let's be clear. We are a lawful abiding country. As we can look in our community, when you go out here tonight, you will see that most people in our country are obeying the rules of the shelter in place. As any service, as the Bermuda Regiment and the Bermuda Police Service, you prepare for everything. It's quite often that they dust off kit for training. Without speaking for them, I can say that this is standard operating procedure to prepare for anything. But let's look at what is presented in front of us now. Our country is lawful. People in the main are respecting the shelter in place. We can look around and see that there is clearly no need for that at this stage.
What is the criteria for the shelter in place to be aborted? Is there 14 days without any new cases?
Trevor, as I have indicated on a number of occasions, that I do not foresee circumstances that the shelter in place will be extended past the 2nd of May. And it is my expectation that on 6 a.m. that the country will come out of this shelter in place. The cabinet will meet on Tuesday, and on Wednesday we will be able to advise the country as to what are the next steps. But the most important part that all persons can play in making sure that happens is to make sure that they're obeying the rules which are currently in place at this particular point in time. Regarding whether or not you're asking in order to come out of shelter in place, whether or not we have to have no new cases, etc., that is not the requirement. What we want to make sure, and as I've said previously, I am not naive enough to believe that Bermuda will be able to have no cases of COVID-19 and completely eliminate COVID-19 from our shores. From an island that will require air services in the future and other things that is not realistic, and that will result in us having overly punitive things inside of our country for a long point in time. The only way that you can prevent COVID-19 from being in Bermuda is to close our borders for 18 months, and that I don't think is something which we can have. So when it comes to looking to lift the shelter in place, we'll take the advice from the Ministry of Health. The Ministry of Health said that in order to make sure that this suppression effort is fully effective, that we need 2 full incubation cycles. The 2 full incubation cycles will end on the 2nd of May, and at that point in time, at 6 a.m., we'll revert to another posture. What that posture will be is not what we had before, where everything is open and you can go, and I can go get my haircut and my shave and all the rest on May 2nd. That's most likely not going to happen. But next week, Wednesday, we will lay out precisely what the next phase will look like.
Thank you. One last question. TNN has learned that many guest workers have received financial packages with the monies that were earmarked for Bermudians during this difficult time. We also have seen that the Cayman Islands has asked guest workers to leave the country and come back when things get better, using up a lot of their financial resources. Is there any thought here in Bermuda that you might ask our guest workers to leave and come back when things are back up and running?
To answer your question, we already have, but there's particular challenges. Just like in the Cayman Islands, where they had a challenge, where they had a plane where they're going to send 160 persons to Nicaragua, and then Nicaragua closed their borders. There was a view to try to make sure that the British Airways flight, which is leaving tomorrow, has persons to use that flight to return home. There are some guest workers there that are returning home, and the laws state that for the unemployment benefit, the only way that a guest worker is eligible for that unemployment benefit is if they were unable to leave the country due to things closing down. But when we look at persons who could have flown through London to other countries, their homes of origin and their countries of origin have their borders closed as well, Trevor. Mm-hmm. And so this is a particular challenge that we have. For us, the decision was made at the very beginning, but we are encouraging persons to leave. Communications did go out to a number of employers regarding this, and there are persons who've taken up that particular offer. But the challenge of which we have is we can't actually get persons to get back home because their borders are closed.
Will the 2 labs that are up and running, will they be corresponding with results to cross-check, meaning the new lab and Helix lab?
I'm not sure what you mean about correspond. Can you repeat that? I'm sorry.
Meaning that one set of tests run from one lab and to confirm or to double check, send them to the other lab. Is that?
Well, like the Premier's indicated, we do have 2 labs that are operational. That's to assist us with respect to the increasing of our testing capacity. There were meetings today, and there'll be further meetings involving all stakeholders, which would involve both persons from the labs as well as the government lab, personnel from the Department of Health, et cetera, to continue on the same train of ensuring that we have testing, ensuring that we're continuing our levels of cooperation, as well as coordinating our efforts. So if that's part of the process where the labs decide that they need to work together, then that would be encouraged, because we are all in this together.
My last question. Can you confirm or deny that Helix Lab is receiving $100,000 for a month for testing?
I can't confirm or deny. I don't know that.
Good evening. With the curve flattening, and you've mentioned that we're going to come out of shelter in place on May 2nd, what does the models say will happen when we lift the shelter in place order?
One more time, please, Don.
Sorry.
Just a little bit louder.
They did say this mic was going to be a little softer. With the curve in Bermuda having flattened over the past few weeks, what does the model say will happen when we lift the shelter in place on May 2nd?
I can answer that.
Okay.
Okay, Don, and I know you just got this, and I'm so keen because as soon as it was off the print, I couldn't wait to give a copy to you because I know that you were very anxious to see the modeling. And Mr. Rosa might be able to add to this, but as we've stated in the modeling, when you look at it, that they don't predict. So the models are simply there to help to provide guidelines insofar as policy decisions so that we can look at what may happen or may not happen depending on different variables. The mitigation measures that we've got in place, as you see, the shelter in place and the social distancing, et cetera, those things will continue. But again, it's important when you dissect and look at the model very carefully. It is not a prediction. It is something to be used by policymakers as to what other circumstances need to be continued, as well as to either be accelerated or paused. It's almost like when you're switching on the water. You can switch it on to get more mitigation, you can switch it off to get less. And those are the factors that will have to be looked at. So the cabinet will be able to use this as a policy decision to make sure that we're addressing the challenges that we have both economically as well as from a health point of view. But I'm also fortunately joined by Diwan DeRosa, who is our Ministry of Health epidemiologist, and I did drag her here, so I'm going to certainly give her an opportunity to be at the mic.
All right, so yes, the model is not intended to be a prediction, and we are continuously working with Public Health England and other mathematicians to refine the model, so it will update over time, and it will incorporate more local surveillance data to see what's happening. So we really have to look at what's happening locally and then adapt our measures based on that to avoid any potential rebounds such as they're seeing in other countries.
Along those sort of lines, under a worst-case scenario, the modeling predicts a peak in May. The better-case scenario sees a steady rise in cases peaking in September. How will this go into guide you in making decisions on lifting certain restrictions?
I would say that. Go ahead.
You want me? Sure. So we have to look at the local situation and where it is in reference to where the models are showing. So if we see that our numbers are increasing and getting nearer or rising above the better case scenario or reaching, hopefully not ever reaching the worst case scenario, then we adapt our measures and put more forcible measures into place, more intense measures into place.
How much was the model have to be adjusted based on our older population? And does the fact that we have an Afro-Caribbean heritage make any difference in that?
Yes, so the model was adjusted for our older population with the guidance of Public Health England, and even though the Afro-Caribbean heritage isn't yet built into the model, they have advised that this could result in more severe outcomes.
Why would that have more severe outcomes?
What they're seeing in England and other countries is that persons with Afro-Caribbean heritage are having poorer outcomes.
The worst case scenario sees nearly 1,000 people needing critical care in the hospital. Again, with the peak in May, and the better case scenario, 359 people needing critical care through mid-September. How much is the hospital prepared to cope with those kind of large numbers?
Well, one of the main reasons why we're taking the steps that we are with respect to 2 cycles of sheltering in place and as well as the other mitigating factors is to try to avoid a surge in COVID-19 cases, positive cases, which could overwhelm our medical system. That's exactly why we're taking the steps that we're taking, so that we can see a gradual surge as opposed to something that's very sharp that could certainly overwhelm the medical system. So those are all the factors that the government is extremely conscious of to ensure that we best guard against that.
Now that we have the model in place, how does that affect how we're doing our testing going forward?
Actually, the modeling is an element of what we can use, like I said, for our projections insofar as the type of mitigation and policy decisions. But on the other hand, the important issue concerning the testing is that we're going to continue to test. And the Premier has indicated that he wants to have full-scale testing. We've got 2 testing facilities. He described one of them today with respect to the drive-through. So we will continue to test, and the modeling and testing go hand in hand. The modeling will help with respect to the predictions and what we will look at from a policy decision, and the testing will obviously let us know to the extent of COVID-19 exists in our community.
Okay, thank you. Two more questions. Of the people currently in the hospital, how many are at ICU and how many are using ventilators?
I believe there are 11 persons in hospital, 4 are on ICU. I don't have the number of how many are on ventilation.
Okay, and the last question, with the BA Airbridge flight arriving today, how long will these returning passengers be required to self-isolate at home after their 14-day mandatory quarantine period is completed?
Okay, we've had this conversation before. Isolation is for persons that are symptomatic. When you mean quarantine, which I think, they will be required to be in quarantine for 14 days. However, further to the extension of quarantine order 2020, which was became operational on the 21st of April, before their departure from the quarantine facility, they will be tested. If they test positive, then they will be required to extend their quarantine in that particular facility for an additional 14 days.
Thank you.
Thank you.
Good evening, Premier, Ministers. Paul Johnston from the Royal Gazette. Mr. Premier, if I could start with you. In your opening tonight, you described the testing at Southside today. To kind of paraphrase what you said that there had been some hiccups, but things are in full swing now. My first question would be, what were the hiccups experienced today, and how many tests were conducted today?
I don't know how many tests were conducted. I was there, I drove up there after my radio interview. We'll certainly be able to get that number for you later, as I think it's going until 7 p.m. The hiccups were just didn't get started on time, and so I think they started a little bit late, but I know by the time I got there, people were driving through and were being tested. I want to thank the Ministry of Health for working and with the community doctors who were there swabbing. In addition, we have, and it's a very interesting story to tell, and it's a story that I learned at the cabinet. We need to take advantage of our people that we have here on island to assist us during this particular challenge. And so I heard a story about a young Bermudian who finished her nursing work and was back here in Bermuda and was actually on a government scholarship and was contacted by a hospital in Ohio in order to come and work for a hospital in Ohio because they had a shortage of nurses there. That young lady is now being recruited to assist us in the swabbing exercise and effort here. So we're making sure we get our people trained up here in Bermuda to assist us with this exercise, and the doctors and nurses from the Department of Health were at Southside earlier today to ensure that that happened. But regarding the total number of tests that were collected today, we'll be happy to get that number. I don't know, and I think it's still ongoing as we speak.
A follow-up to that, how big is the pool of uniformed service members and other high-risk essential workers? And when is it anticipated that all will have received their initial test?
I thank you very much for your second question. Regarding that, what I would say is that there is, off the top of the head, we have 400-something police officers, a number of prison officers. There's a large number of uniformed persons.
So there are a number of people that will be tested from the uniformed services. Clearly, the ones that are on the front line are the main people that will get tested. There is a computerized process of making appointments, and we're following the process. We do know that there are people from the Ministry of Health that might want to be tested as well, so we're being flexible in that regard. But the main effort is for anyone that wants to get tested within our ministries. They will be first, and the frontline persons, and we will work a plan that is computerized with the appointment system of working through all of the people within our ministry.
And if I can try and drill you down, when is it anticipated that all of those frontline workers...
You can try to drill me down, but I will tell you that we're going through a systematic process that is based on a computerized matrix. When that process is completed, kind sir, it will be completed.
Will testing of these uniformed services and other high-risk essential workers, will this be ongoing testing?
Yes.
Yes. Okay. Minister Wilson, if I could turn to you. The modeling data that came out today, as you said, these aren't predictions, but instead estimates. As Don said just a while ago, worst case scenario lists 3,096 people hospitalized, 981 requiring critical care. The better case scenario, there are estimated to be 1,030 hospitalizations with 359 requiring critical care. Can CAMH handle both scenarios?
Well, I think that was a question that was asked, I think it was last week when Dr. Richmond was here, and he was able to provide a full detail of the level of preparedness that BHB has. I'd actually invite you to look at perhaps that interview, but in essence, what we are trying to do is avoid the worst case scenario. And the worst case scenario, as illustrated by the figures that you've just revealed, would be a situation in Bermuda in the event that we had no intervention. Well, fortunately, Bermuda isn't in that particular scenario because we have quite a lot of intervention in addition to social distancing and the existing shelter-in-place provisions. However, again, the whole purpose of looking at the modeling from a policy point of view, as well as the continuation of our testing regime, is to avoid getting even to that better case scenario. That is the best case scenario, but we're looking to see if we can even do better than that. But we need to be realistic and make sure, let me finish, please, and make sure that the public also are aware of the reality of the situation. COVID-19 is evolving. I think the only thing stagnant about COVID-19 is the fact that it just continues to change. There's nothing about it that it's new and it's evolving. The reality is that we are trying to do what we can in Bermuda with respect to our mitigation so that we don't have the worst case scenario, but that worst case scenario was based on no intervention at all. And we aren't in that particular position as well. When you look at the better case scenario, the hospital believes that they have the level of preparedness for Bermuda in this circumstance. However, again, we are taking steps to ensure that we don't see a particular surge that will overwhelm our hospital system and our medical healthcare system.
So is that Bermuda is prepared to handle both of these scenarios?
Well, like I said, the worst case scenario would not happen in Bermuda unless we had no intervention. And right now, you and I are 6 feet apart, so we do have elements of intervention.
Sure.
We also have a shelter in place, which we're on week 3. So that worst case scenario, as I spoke to, and I'd invite you to look at the modeling details, that speaks about a worst case scenario generated by a 2.4, which is for every person that's infected, they would infect 2.4 persons. But that worst case scenario assumes no intervention has taken place. So fortunately, Bermuda is not in that particular position. However, if we look at the better case scenario, which is what we're aiming to be at a minimal, it will be a challenge to our healthcare system, but you'll note that the biggest, the surge for Bermuda will be over a couple of day period in May. So we have plenty of time. In addition to prepare for that, it'll be over a few day period. We're not going to look at an immediate surge because we are going to be applying the mitigants accordingly so that we have the proper interventions.
And the better case scenario is in September, not May, of course.
Did I say May? Yes, September, excuse me, sorry,
And
September,
I
thank
just
you.
want for the members of the watching audience to note that we did present the modeling information tonight. However, it was sent to all members of the media in advance of the press conference so that they could have that so they can prepare and answer their questions.
Minister Wilson, you mentioned that testing of residents had taken place at 4 care homes this evening.
That's correct.
2 of which we know, obviously Westmeath and Matilda Smith Williams. What are the other 2 homes where testing of residents
I'm
has
actually
taken
not
place?
sure that that's a necessary question. If there's a situation, as Dr. People mentioned the other day, where we see in those care homes residents test positive, then obviously from a public health point of view, then we will disclose that information, but we are still waiting for the results of those care homes. And as we've seen today, with respect to the anguish that's been caused to many of the residents at Westmeath with the reporting of information that the patients didn't themselves know about. And unfortunately, some people might think of it as a statistic, but it's actually parents and grandparents and loved ones. So I'm sure that they would also, from the other 2 homes that we're speaking about, prefer to not have their the names of the homes released unless we have to from a public health point of view because we see that there is transmission within the residents.
maybe playing devil's advocate a bit, what is the danger in releasing the name of the homes? Is it worrying about stigmatizing the residents or the family members?
That's absolutely part of it, yes. If we release the name of a home and there are no positive cases, then we are stigmatizing those family members and the loved ones that are in the homes, as well as those staff members that care for those persons 24/7 out of love and compassion.
I think, Paul, that's your 6 questions. Thank you.
Hold on.
Good evening, panel. Premier, the worst case scenarios all point to a surge in mid-May. You would know that this school year, as we know it, ends in June. For parents, particularly of primary and preschoolers, I believe you and the minister fit in that category, and I acknowledge he's not here. But is it feasible at this point to maybe get parents to wrap their heads around the fact that the school year may not reopen?
I don't believe that's part of our current planning. But as I said, until we have a conversation around the cabinet table on these specific instances, I know that the minister had a conversation previously and will make those decisions as we go forward. Do I believe that schools are going to open on May 2nd or soon after May 2nd? No. Do I believe that the current thinking of the government is to leave schools closed until next year? No. But we have to look at the situation, examine the data, and then make the decisions based upon the information at hand, whether or not the system can handle it. What are the things that can be put in place in order to protect and mitigate? You'll see that. But I think that some of the studies which have been said is that there is, because of how this virus is, and it affects younger persons less than it affects older persons, and that's not necessarily something that I would say, that's not necessarily something from that perspective, we just have to look and examine it. But I think it's also important to note that those school buildings are closed, schooling is still going on.
So technically, if in fact they reopen, say, for this last 2 weeks in June, could there be consideration of extending the school year?
All things will be considered, certainly, Ciola. I mean, the fact is, and I'm not trying to be deliberately evasive, but these are hypothetical questions at a point in time when we are actually really focused on the matters at hand right now and making sure we're dealing with these particular things. The Minister of Education himself, who I believe might actually be here on Monday, will be the one who will be working through that particular issue. But just for the information of our, the viewing audience, on Tuesday at the cabinet meeting, I charged Lieutenant Colonel David Birch, the Minister of Public Works, with coordinating the effort for reopening the economy. And there's a number of pillars when it comes to reopening for business. Number one is what you mentioned, education. Number two is in the regular business community and what's taking place inside of society, which is being handled by the Minister of National Security. Number three is the issue of our tourism industry, which is being handled by the Minister of Tourism. And the fourth one, which is the matter of opening up government buildings, how all of that works, which is underneath the purview of myself as the minister nominally responsible for the public service, but also with the minister responsible for public works, who is responsible for all government buildings. And all of our decisions will be informed by the Ministry of Health and the public health advice that's given. They've gone through a matrix and have provided a matrix to the government about how you look at the reopening of certain things. And I think as we've given this modeling information, as we move forward down that path, I think it might be helpful for the Minister of Public Works to walk through how we're going to examine that process. And we're going to look at things which are provide the best value, I would say, for the economy, but have the lowest level of transmission risk, because we want to make sure we get people back to work.
With regards to, say, the public transportation service, that would follow that shelter in place will probably mean traveling at half capacity. Any considerations there, and perhaps using the minibuses? Because I hear the minister mention taxis, but minibuses are still parked.
Mm-hmm. Thank you. I think the minister had mentioned taxis in regards to just deliveries which are taking place currently right now. But on a broader question, I think your question is a good one. What does the future of the public transportation system look like when we come out of shelter in place? We've seen in other places where they had limited ridership, et cetera. Those decisions have not yet been made. But I think that it's important to note that if we start opening the economy and if we start getting people back to work, we have to make the recognition and understanding that not everyone has a car, so they need to find a way to get around. And we need to make sure that we are making that happen. So I'm not going to give the exact predictions. I've charged the Minister of Public Works with coming together with that particular plan, and we'll certainly be able to reveal some more of those details following our cabinet meeting on Tuesday when we talk about what the next week will look like, and also looking forward to the considerations of which are being made. But we certainly recognize that public transport is value, and what we're going to make sure we do is to protect our employees with the appropriate PPE, and given that we have more and more PPE arriving on island every day, I think it'll be an easier task than it would have been a month ago.
A lot of questions today about the hours for weekend drive-through express. Any chance of having it up at the other end of the island as well for the COVID testing for essential workers? And where do hospital workers fit in? Would it have not made sense to test hospital and those frontline workers first?
Do you want to take the hospital?
Sure. Thank you, Sheila. That's a very good question. The hospital workers actually are continuously getting, the hospital workers have been getting tested because they obviously are at the front line as well. So they've been continuously getting testing since we started the testing regime. And the community testing that takes place centrally is taking place, sometimes it's at Bull's Head, but depending on the weather, then sometimes it's at the clinic, the Hamilton Clinic. Insofar as considering perhaps another testing facility in the West End, at this point, it's perhaps not advisable simply because every time you go through the testing facility, you have to have PPE. So they have to utilize the PPE to do the testing. It's probably more controlled if we're able to have it at just 2 locations.
I'm just about done. With regards to the banks, I'm assuming they made individual decisions during this last week of the carryover, but with just one day a week, Thursday and Fridays, a lot of seniors were forced to line up for miles Thursday and Friday. Last week, particular, when their either social insurance or pension checks came. Any complaints there? Or
I can't necessarily
concerns
speak
there?
to complaints, but what I can say, the Minister of National Security might have some stuff to add to that, that this was their particular decision. And so that's the decision of the banks. And so from that perspective, we respect their decision to basically make sure that we can do as much sheltering in its place as is possible. Minister, you wish to add anything?
Ciola, we have and will continue to meet with the Bermuda Bankers Association and the Chamber of Commerce. We will look at, and this is a work in progress, and so sometimes you make a decision and it works well, sometimes you make a decision and it doesn't work well, and we have to test and adjust our position. I too saw the line wrapped around the building this morning. It gives us opportunity to continue the discussion. Next week we will do so, and if it makes sense and it is in keeping with the public health instructions, we will be able to test and adjust our position.
And one final question my readers have asked, and this may have came up on Wednesday. I didn't see the whole tape, but Premier, you in particular have stated that the government feels for those who have been economically displaced and share in their pain. They want to know exactly, with your 6-digit salary and your cabinet, what are you prepared to give up? When we have other leaders, say in Australia or somewhere, who have given up a percentage of their salary in light of what people are going through.
And here's what I'll say, Ciola. I will say the question is asked every single time at a press conference. I think this is 4 consecutive press
Okay,
conferences.
I apologize.
And the
I
answer will be the
missed it.
same, that the Minister of Finance, as he indicated last week Wednesday, said that all considerations are on the table. I'm not going to preempt that conversation or discussion, but there is a wide variety of things that are being looked at in regards to what is it that we're going to do to make sure that we can make our budgets balanced this year, given the fact that there is going to be a revenue shortfall.
Yes, I'm told it's New Zealand. I couldn't get it. I'm sorry. Thank you.
That's it. Okay. Thank you very much to the members of the media for your questions. Regarding our next press conference will be on Monday evening, right here again. As the Minister of Health has indicated that there will be a testing update that will be released tonight, and that release tonight is going to, yes, as soon which will be following the notifications of doctors, and also there's going to be a testing update that is going to be released tomorrow as well. There will be no testing update that will release on Sunday. It is a day that we are going to make sure that all officials, including Ms. Wanda Rosa and others, have a day off so they do not have to necessarily compile reports and press releases to have a day of rest, as they have been working at this marathon for quite some time. To all the persons who are watching online, for all the persons who are continuing to follow the rules, and to all the persons who are recognizing that this is a community effort and we must be in this together, thank you for your continued support in this particular endeavor. Have a wonderful weekend and take care.